Hi, I'm Dr. Broussard with the Wagon Train Veterinary Clinic, and in today's segment we're going to discuss how to prepare for your dog's upcoming surgery. We put together a list of commonly asked questions, and my assistant Cole and I are going to run through those questions for you to hopefully give you a better understanding. Cole?
Dr. Broussard, does my dog need to be fasted for surgery and why?
Yeah, so if your dog is having a surgical procedure, particularly one where they're going to go into general anesthetic, which I would argue to say probably 90% of surgical procedures do go under general anesthesia. Yeah, it would be wise to be fasted. Food for sure, perhaps even water, at least for a few hours leading up to the surgery, guys. And the big reason why is because when they're under anesthesia at that depth, okay, when they're at that surgical plane of anesthesia, they lose the ability to swallow. Okay, if anybody's ever had surgery, you wouldn't remember that because you were under anesthesia for the same reason. So a dog is going to be that deep. They have no memory, no recollection. They have no clue anything's even happening. And one of the things that they lose is the ability to swallow. So when we put them under general anesthesia, they are intubated, and we have an inflatable cuff that seals off their airway. So if they do try to, not even vomit, but if there's any reflux from stomach materials, be it acid, water, or food, if it tries to come up, they can't then in turn inhale it into their lungs. Aspiration pneumonia, it's real, it happens, and it's really bad. So that's where the fasting comes in. It's not because we're trying to be an inconvenience to you or be a pain in the you-know-what to you. It's important that animal has an empty stomach so they cannot aspirate under the anesthesia or during the anesthetic procedure.
When can my dog return to normal feeding and activity after surgery?
It really varies on the pet. So okay, the majority of cases we do are castrations and spays, if you will. That's the bulk of what we do, okay? Most of those guys go home the same afternoon. So if I do a surgery at 8, 9 o'clock that morning, they're usually home for 3, 4 o'clock that afternoon. Do I allow them to eat that first day? Yeah, you bet I do. I always tell people to go easy, maybe feed half of their normal amount, and I try not to feed them a great big meal. But the reality is some dogs don't want to eat the day of, or not very well anyway, because look, younger patients might blow through anesthesia really quick, wake up like nothing ever happened, and they're ready to eat a whole bag of food. But that's rare. More times than not, these guys do have a little bit of recovery time. They're not going to be feeling 100%. Maybe they're a little queasy, they're nauseous, something like that. So they may not want to eat all that well. Can they? Yes, but smaller amounts and no big meals. Water, I will typically tell them, if they want water, they can have that shortly after surgery. But again, small quantities, and give them multiple opportunities as opposed to putting one giant bowl and let them engorge themselves. Okay, and as for the second part of that question, the activity and activity restriction, again, depending on what surgery was done, usually you'd want to like leash walk. Like if you're not directly with the dog, I always tell them put them in a kennel, put them in a small space where there's nothing there for them to do but rest. So I want that first and foremost. But if you do have to, I mean, let's be honest, they got to go outside, they have to use the bathroom, maybe even take them for a light walk, do it on a leash. And what I hear from people all the time is, yeah, but he's calm, he never runs. Don't take that chance. If it can happen, it will happen. Murphy's Law. So if you do take him for a walk, put him on a leash, please. It doesn't matter if you go just to the end of your driveway and back or around the block, it doesn't matter, but it limits the exercise and it limits the chance for them taking off running at the neighbor's dog or cat or a kid playing or who knows what, and then potentially really damaging the surgery that was just done. So,
Will my dog need post-surgery pain medication?
Most times, yeah. Again, depends on the veterinarian, depends on the procedure that was done. But if it was a procedure that required surgery, then it usually is going to have some pain and inflammation involved with it afterwards. So yes, we often use anti-inflammatories like NSAIDs, whether it's Previcox, Rimadyl, and 100 other brands I won't bore you with right now, or more of an opioid type drug like morphine, buprenorphine, even gabapentin is one that's really coming into favor lately that helps control pain. So there's a lot of different modalities that are out there that can help control pain, and yes, we typically do that because the last thing I want is for a dog to go home and be painful and then start chewing at the incision or that kind of thing. So, okay. Okay, well that's it guys. I appreciate y'all tuning in. If you have any more questions, reach out to us. You can come by the office, you can catch us on Facebook, whatever way is easiest to you. But I appreciate you tuning in and we'll talk to you soon. Bye-bye.